even care anymore. You know, like you get past, and the longer somebody restricts, the more your hunger, like it just shrinks. It's like, you know, your stomach shrinks.
Yeah.
With overeating, it's sort of the opposite. You can get to that point where you actually don't feel the fullness because you're so numb from the food that you don't even know that you're full. So it can work in both directions. Does that make sense? And one of the hardest things for people in recovery from anorexia and also binge eating disorder is bringing that back. You know, when someone goes into treatment, one of the things that they have to do is they have to just be monitored with each meal, and like they have to eat at 12 o'clock even if they're not hungry, because part of recovery is like bringing that part of you back, and it can be very hard and uncomfortable because you think you're not hungry and like they're forcing me to eat, but really what they're trying to do is bring your hunger back into like so you can actually feel it, and that eventually goes away so you can get it back. I mean, at this point in my life, I definitely feel hunger. I like addressing it. I think it's fun to eat, and I know when I'm done, like it's like, yeah, I think I'm full now, and I thoroughly enjoy my hunger at this point in my life. I'm so glad it's back because I love to eat. You know, I think food's fun. I know, right? The girl's saying food's fun, and she has, but I do. I like it. Yeah.
I know there's sort of this common conception that like people have different metabolisms, and some people can eat whatever they want and be fine, and some people have to really monitor what they eat to not become overweight. Is that like a myth, or is that true? And how does that play into people's relationship with food and whether or not they let it rule their life?
Is it a myth meaning?
Like, are there some people who can just eat whatever they want, or are there some people that have to really closely monitor what they eat to avoid becoming obese?
I think there's a genetic piece. Like some people have obesity in their family, so they do have to be more probably mindful with food. I think that there are some people who can have very fast metabolisms. I don't necessarily know that it's a lifelong thing. I think when you're younger, like you might know people at your age that can just eat whatever they want and it's like doesn't matter. But when you get to be like, you know, like my age or even like in your 20s and 30s, that can change. So I don't know if it's a myth. It's more like, again, there's some of each. There are some people who really just have very quick metabolisms. You might think, well, they're lucky, they can eat whatever they want, but probably that won't be for the rest of their life. There are other people who have, for whatever reason, just will more quickly gain weight or have tendency to be overweight because of genetics. So it's more like what you know about your family background. In my family, my mom's brother was like morbidly obese, and I didn't even realize this until years after therapy, but my mom definitely has or had a lot of issues with food in terms of like obsessing and worrying, and again, she didn't look anorexic, she didn't act anorexic, but like she was very hard on me with my weight, and I didn't realize this 2 years later, but she was probably afraid of being like her brother, so she went the opposite way, and she was also very critical of my body. So I think that she was thinking, well, if he's that overweight, what if that happens to me? I think he was really overweight partly because he was heavily medicated for bipolar disorder, but like back then, people didn't understand that certain medicines can definitely also put weight on us, and it's not our fault. So I think that the more we know, the better off we are. The more you know about your family and your background, the better off you are.
Can you tell us a little bit about your story, like how when you went to college your eating sort of changed, and also how you've reached the point of realizing that you needed to get help?
I didn't tell you guys that part, right? The help part.
Right.
Wait, what was the first part of the question about the college?
Just how when you went to college your eating disorder changed, or like how basically, I guess in the different stages of your life, how your eating disorder changed and how you controlled what you ate differently, and I don't know.
I think what happened was I was overeating in my younger childhood years. As soon as I got like the puberty thing going on, I started to do the weight loss thing. When I was in high school, I was very involved in theater and dancing, so there was a lot of like pressure to be thin. I was trying to pursue some professional work, so I was also getting like pretty heavily criticized by people in the theater industry. So during high school, I think I was definitely like in anorexia. When I got to college, I think what happened and how my eating disorder changed was I had distance from my family, and I started to realize this is not good what's going on here, and I don't really like I thought I was really close to my parents, but like I really wasn't. So for me, I didn't want to accept that. It was too scary to like know really where I came from. So I actually became more anorexic in college, not having anything to do with sorority, but more because I was just not wanting to have to accept that like in order to really be happy and healthy, I was probably going to have to distance from the people who gave birth to me. So I think college and the year after were the worst. I was at my lowest weight. I was at the gym 3 or 4 hours a day. I was performing 8 shows a week at night. I was at Hofstra. I would go to the gym, get in my car, drive to the theater, which was 2 hours away, do 8 shows a week, have my homework. Like, it was horrible. And like performing on stage without having eaten and being lightheaded. And people, at that point, some people were actually saying stuff like, but I thought it was a good thing. I thought that they were telling me I looked good. I didn't realize that they were telling me.
What were they saying?
Some of them were saying, you look like you're losing weight. I'm like, yeah. And I thought that they meant good for you, but there was one person that knew me from like maybe 14 or 15, and she didn't think it was a good thing. And I still remember, she was just kind of like, you've lost a lot of weight, but like when you have an eating disorder, you can flip things around and distort. So part of me knew, I think I'm getting caught here, or I think I'm in trouble, and another part of me was like, good for me, like I did a good thing. I never forgot that. So when I left college, the year after you graduate, it's tough. It's hard. I miss my sorority sisters so much, because you go from having all these friends to like, oh my God, like I don't have any friends because I had to move back home. It was really bad. I moved out of my house and I lived in a really bad situation. I was by myself, so I can't even fully tell you what was happening that last year because I was so out of it. I was in school getting my master's degree. I think what got me to get help, honestly, was I was volunteering at a place for eating disorders, and I sat in a therapy group, and like one of the girls said that she had a history of trauma, and that she also was anorexic, and I remember thinking, uh-oh, I think she just said my story.
So did you not realize it until that point, or had you kind of known before?
I didn't realize it on a conscious level, and I don't know if that's too fancy of a word for you guys. It was kind of like on a surface level, I was like, my life is good, my family's good, my this is good. At that point, I knew my family wasn't so good, but I don't think I really knew the extent of what I meant by that. I was just so focused on losing weight and being thin and all that it wasn't until I sat in that group that day, it was kind of like, uh-oh. And it took me a while because I sat in that group and I don't think I got therapy for another year. Mm-hmm. But I still remember I don't remember her name, but I remember what she looks like. I can remember everything about that day. And we're talking like almost 20 years ago. Okay. So what happened for me was I got into therapy and I made sure I worked with somebody, and I don't know how I knew how to do this, but I got a therapist that I knew specialized in this stuff. She was like the New Jersey chapter president of one of the eating disorder associations, so I went to see her. Now the thing is, I didn't actually even tell her that I was having an eating disorder until 2 years after I met her. And she specialized in it. I called her and basically just said, I think I have some issues with self-esteem, and I don't know if my family life is so good. So I basically sat in therapy and didn't say. I wasn't, again, trying to hide it. I just think I didn't want to have to let go of it. Right. It wasn't until my late 20s that I was ready to confront things. I don't think it's like that for everybody. I think there are a lot of people with eating disorders that have wonderful families and great lives, but there's issues, and those people might have an easier time talking about their eating disorders from the second they walk into therapy. For me, it was like I needed that. I needed to have a way to distract from things that I couldn't deal with. And if I got into details about that, I think you guys it would be too confusing, and it doesn't really matter. But a lot of people use eating disorders to stay in denial about the problems in their life. That might be a general way of me saying what that meant for me. So then I got help. The thing that happened for me is once I started saying I have issues with food, and I didn't call it an eating disorder probably till, I don't think, maybe 5 or 6 years ago. I never disclosed about my eating disorder in my work or did this kind of stuff as a survivor. I've done a lot of workshops, but never actually did what I'm doing tonight till 5 years ago.
Right. So what is your profession now? Are you a therapist? Okay.
Yeah. But what I would do is I've been a therapist for like 17 years. I would say I specialize in it because I did, but I wouldn't actually, like I have a website now and it says on my website like how she uses her personal experience of surviving trauma to help others heal or whatever. And like there are articles about me and the fact that I had an eating disorder. I didn't do that for years and years after I was in therapy because I felt ashamed about it. I couldn't even use the word binge eating because I was so embarrassed. That's one of the other reasons why I like really want to do talks, because I think that's just, there's nothing, like I don't feel that anymore. I could, like, if someone judges me for it, I'm like, just go away, who cares? I don't care. I think good for me. I did what I had to do to survive. I don't think it's good that I had an eating disorder, but listen, like, it kept me alive. It kept me, like, I don't know, in some ways it actually helped me. That doesn't mean I should have one or you should have one. I just understand it now, and that now my life is so much better.
And just one other question, sorry.
No.
When I was in high school, one of my really good friends and her twin sister had an eating disorder. And I'm not sure about her twin sister, but she was... my friend herself was anorexic and bulimic, and I know she had to be pulled out of school twice because the fat around her heart was not at the right, I guess, she didn't have enough of it, so her heart rate slowed. Did you have any medical issues like that?
I don't know if I actually had that because I never actually went to the doctor for my eating disorder because nobody knew. I definitely had a lot of the things that they say. I even brought it with me, like the warning signs, like my heart itself, I couldn't tell you. I know that I was having panic attacks all the time and I had was dizzy all the time. I probably wasn't great. I was lucky. I had more like I never got my period, my hair fell out, my skin was gross. I probably, it's not that I blocked it, I just don't even really remember completely what it was like. I know some people that I work with have issues with their cardiac.
Yeah, like hers was really bad. Like it dropped under I don't know, 50 beats per minute.
If I had gone to the doctor during the height of my eating disorder, I probably would have been put in the hospital.
Okay.
And again, some people are lucky. Like the thing that scares me about eating disorders is a lot of times you can't see what's wrong. You can't look at. I can't look at. I know that I think I look bad, but I don't know if my heart's not working. Do you know what I'm saying? You could be having health issues from your eating disorder and have not a clue unless you're getting lab work. And even if you go for blood work or echoes, they don't always say the whole story. Do you know what I'm saying? That's tricky because some people will say to me, yeah, but I went to the doctor and everything was fine. And it's kind of like, well, you're lucky that everything was fine, but you don't know that it's going to stay fine. And you don't actually know that it is fine. Just because the blood work says that you're within normal that doesn't actually mean that it's normal for you.
Right.
Somebody in my family is a big fad diet or yo-yo diets. When she's obsessed with it and wants to talk about all the time and is super dedicated. And then when she's not doing one, she just will gain everything back. And I was just wondering if you could talk about different ones, if there are any fad diets that can be healthy, which ones are really bad.
I don't believe in dieting because I did it for years and I think it just messed me up and made me just really have a crappy life and a crappy relationship with food. I've never met anyone who's done a fad diet and had success or have had healthy outcomes. I think when it comes to weight loss and dieting, the best thing you can do is seek nutritional or medical counseling, and I would do that. I would go that route. I think that the fad diets are more about the faster, it's that immediate relief. And if you lose weight really fast, it's not whether you gain it back or not. It's not good for your body. It doesn't really help you to make changes with your relationship with food. When I went from overeating to undereating, I wasn't doing that. Eating, I don't know what I was eating. At that time, they were saying no more than 1,000 calories a day. Well, but how was that a good thing for me? Just because I was losing weight, I wasn't healthy. So I don't like diets. I don't even like the word because I think, no, it's just more if you have issues with food or you use food, sometimes you eat when you're not hungry, you just need to understand why that is. And if you can work on that, you'll lose weight naturally. Do you know what I mean? Like, you don't have to be on a diet to lose weight. Like, I'm not on a diet. I had a baby. I'm not on a diet. But, like, very slowly, my body's coming back to what it was because I'm eating when I'm hungry and I'm not eating. Like, I stop when I'm full. I go to the gym 4 or 5 days